Hi and welcome. I'm trying to learn medicine. Today, acid regurgitation. And after we've done it, we're gonna do short impingement training. And if you participate in the short impingement training, then it's better than honest. This is part 2 already. Now we try to take information we have here and make them as a little presentation video. Now, I forgot to say that we are talking about internal anatomy and illness, and this is no medical advice, we're just learning about it. Acid regurgitation. That is a condition in which the contents of the stomach flow back into the esophagus and cause inflammation. Okay, acid regurgitation, the content of the stomach are coming up into the esophagus and causing inflammation. The symptoms are a burning sensation behind the breastbone, which may spread up to the back of the mouth as wind is brought up, giving a taste of acid and food. Burning sensation behind the breastbone, I still don't know where the breastbone is. A burning sensation behind the breastbone and a taste of acid and food, and maybe a taste of acid and food. The symptoms persist unless treated. Okay, we don't have to save it, I think, but it's too vague. Causes: lax muscles at the lower end of the esophagus, food pipe where it joins the stomach. They allow acid to flow back up to the stomach, up from the stomach. Overindulgence, wearing tight corsets, belts, seatbelts, bending down or lying flat tends to force food from the stomach backwards into the esophagus, which consequently aggravated of symptoms. Okay, lax muscles at the lower end of the esophagus, overindulgence, tight clothes, belts, seatbelts, and lying onto the tummy of his stomach, bending down or lying flat. Lying flat also. Down bending or lying flat. Lax muscle, then tight clothes, mechanical stress, overindulgence, lax muscle, overindulgence, tight clothes, seatbelts, whatever, and lying flat. Complications: peptic or reflux esophagitis. The lining of the esophagus becomes inflamed when ulcerated by the action of stomach juices. I don't know, it's not the explanation of inflamed and ulcerated esophagitis. Let's take a little exception. Let's look if we have esophagitis. Okay. Esophagus stricture, esophagitis. Inflammation of the esophagus and food pipe. The burning with symptoms, duration, causes, complications. It's basically the same. It's just inflammation. Peptic or reflux esophagitis can it cause acid regurgitation. Where we are. Peptic or reflux esophagitis. The lining of the esophagus becomes inflamed and when ulcerated. Let's say that. Peptic or reflux esophagitis. The lining of the esophagus becomes inflamed and ulcerated. Stricture narrowing of the esophagus may eventually result ends narrowing of the esophagus. Inflammation, ulcerated, stricture, is that called? Stricture or narrowing, esophagitis, peptic or reflux esophagitis. Bleeding, usually a cell loss resulting in anemia. A reduction in the quantity of oxygen-carrying hemoglobin in the blood. Anemia is the most common of all the blood diseases and occurs in various forms: iron deficiency, pernicious, sickle cell, and megaloblastic. Anemia, a reduction in the quantity of oxygen-carrying hemoglobin. Let's not save it. Treatment in the home, not wearing tight clothes, small meals or emergency. What the doctor might do: antacids, X-ray, investigate the cause. Overeating, overdrinking, overindulgence, and overweightness. Overweightness? We didn't list this as cause. Okay, we want to concentrate on the acid regurgitation. Content of the stomach flows back into the esophagus, and that can cause, do we say it here? And that can cause peptide or reflux. Reflux? I cannot know anymore. Peptic or reflux esophagitis, and that is inflammation and ulceration of the lignin of the esophagus, and it can also cause stricture, narrowing of the esophagus. It can feel as a burning sensation behind the breastbone, can spread up to the mouth, and can taste like acid in food. The causes are lax muscles at the lower end of the esophagus. Lax muscles of the esophagus, but also overindulgence, wearing tight clothes, belts or seat belts, or bending down can make it worse. There is the advice of eating smaller meals, to not wear tight clothes, and to not be overweight. And there are possible some treatments with medications. That is according to Keith Hodgkin's Family Medical Advisor, page 61. No, I can't say that all, no. Let's try it again. It is backflow, can we say it? Flow back. It is backflow of stomach content into the achalasia of the cardia. That was the other thing. The food doesn't come properly into the stomach. That is achalasia of the cardia. That's the big difference. Maybe we're going to do a video about it. No, that's the difference. I was wondering. The content of the stomach flows up, and the reason are lax muscles at the end of the esophagus, the food pipe, and it can give a burning sensation behind the breastbone. It can spread up to the mouth, and it can taste like acid in the food. The causes are part of lax muscles at the lower end of the esophagus, maybe overweightness and overindulgence in food and drinking, and bending forward or lying down, and wearing tight clothes, belts or seat belts. Was it all a part of the symptoms of the treatment? Yes, complication. It can lead to peptic or reflux esophagitis, that is inflammation and ulceration of the esophagus, and also to stricture, narrowing of the esophagus. Probably also some other things. Here we had that achalasia of the cardia can make esophageal cancer more likely. I would guess acid regurgitation does it too, but it's not written here, so maybe not. And it is advised to take smaller meals, not to be overweight, not to wear tight clothes. There is also medication against it. And what was it? Okay. But we're over time, and I have no time to do it now. So in the next part of medicine, we try to do the presentation of that what we learned here. Now we're gonna do the short training. If you were here for medicine, you can go right to the next part of medicine. We will do the short training, and you participate with your home risk according to the and we do forward shoulder circles. And backwards. Last time. And now, long arms, strong fists, and go as far back as you can with the shoulders. High up, and front, down, back, up, front, down, and again back. Now we're accelerating motorcycles, legs wide apart into the knees, hinge forward with a straight back, let the arms in, and pinch the scapula together with effort. Make fists, lift the arms up and still pinch the scapula. And release. And another time. Pinch the scapula together. Make fists, lift the arms up and still pinch the scapula together. And release. And the sheet jump up into the knees. Pinch forward. Put it on back, lift the arms hang, make fists, turn the arms to the inside, lift the arms high up and bring them together. Straighten up, bring the shoulders down, together. Arms high up, together, shoulders down, together. Relax. And then round into the knees, hand forward, with the round back, let the arms hang, make fists, turn the arms to the inside, lift the arms high up, bring them together. Straighten up, bring the shoulders down, together. And now, just lift the arms up. And again up. If this or any other exercise causes pain, then don't do it. Arms to the side and out front. Now we will lift our long arms, strong fists, shoulders back, hands together. Bring the arms to the inside, shoulders down, hands together. Arms to the outside, shoulders down, hands together. To the inside with the arms, shoulders down, hands together. Arms to the outside, shoulders down, hands together. And release. Now arms to the side, a bit in front, arms in front, shoulders down, hands together. Arms back, shoulders up, and in front. Arms in front, shoulders back, together. Arms back, shoulders up, and out front. Release. Now shrug. Lift the arms up, and shrug, shoulders up, and again down. Again the arms up, shrug, shoulders up, and go down. The arms up, and shoulders up, and down. Now we pencil curl the arms together, a bit down to the sides, and down, and together. And to the next exercise, the sunlight. You can also use a tennis ball or whatever. Here is the long end to the outside, and fall down, try to catch it here. And on the other side. Now we're stretching. One arm in front, pull it in. The shoulders back and down with the arm. Pull the arm in and have flat fingers. Try to relax the arm. Go a bit back with the shoulder and turn the palm up to the sky. A bit. And the other arm in front. Shoulders back and down. Pull the arm in. Have flat fingers. Try to relax the arm. Go a bit back with the shoulder. Turn the palm up to the sky. That was a shoulder pinch training. Thank you very much. And until next time.